We will talk about rheumatism. It means pain of muscles and joints. And when person says about rheumatism, he or she does not mean any specific disease, but it's umbrella term, and under it we can mean many different conditions, but main characteristic is joint pain or arthritis. This term is from ancient Greek, where rheuma means flow and ism means condition, and ancient Greeks thought that this balance between flow, our fluids, cause pain. That's why they call it rheumatism. And in modern medicine, if we say rheumatism, we usually mean rheumatoid arthritis. Rheumatoid arthritis is autoimmune disorder when our own immune system mistakenly attacks synovium lining of our joints and cause pain, inflammation, and swelling. And it's inflammatory condition which affects usually smaller joints. And classical patients is middle-aged women, but it can occur at any age and at any gender, but usually in middle-aged women. Cause is not known, it's usually genetic, have some genetic and environmental factors. And what we have treatment is disease modifying anti-rheumatoid drugs, also anti-inflammatory drugs. Second disease, which is very common also, and we can mean under the term of rheumatism, is osteoarthritis. Osteoarthritis is degenerative disorder which is highly correlated with age. It means that during age increases risk of osteoarthritis dramatically. It causes destruction and degeneration of cartilage and joint, and it causes deformities. Usually it affects large joints such as knee, hip, and spine. Also it can affect smaller joints, but usually affects large joints. Risk factors include joint injury, trauma, obesity, and genetics. And patient will say that she has joint pain, stiffness, and decreased range of motion. Treatment is pain relievers, non-steroidal anti-inflammatory drugs, physical therapy, and if condition is serious, joint replacement surgery is solution. Another disease which is also common, and we can mean it under the umbrella of rheumatism, is gout. At the base of your big toe, this pain is very severe. It's attack-like pain, usually occurs at night, and it is caused by uric acid deposition in blood, and eventually it deposits as a crystals in the joints, and it causes serious pain. And what is risk factor? Risk factor is poor and rich diet, obesity, and certain medications and genetics. And treatment is non-steroidal anti-inflammatory drugs, colchicine, and dietary shifts. You should eat food which are not rich in purine, for example bread and rice. Another disease which is part of also a rheumatic disease is systemic lupus erythematosus. It's also autoimmune disease. It means that immune system attacks different types of tissues, including skins, different organs, including kidneys and joints also. It causes joint pain, redness of skin, and you can see this classical appearance of systemic lupus erythematosus, which is butterfly rash, butterfly type rash. It's characteristic for systemic lupus erythematosus, and it has rash, joint pain, fatigue, and fever. Usually occurs in young women, and you can differentiate it from other disorders. Person should avoid excessive sun exposure, and also immunosuppressive drugs and anti-inflammatory drugs are effective and part of treatment. And another disease is scleroderma. Scleroderma is deposition of collagen, which is protein, and it deposits and hardens and tightens skin and restricts movement of joints, and it causes pain also. It's common also among women, and immunosuppressive medication is treatment here also. And other conditions also can cause rheumatism. Such conditions are ankylosing spondylitis, which targets spine, psoriatic arthritis, which means when psoriasis affects joints, it causes psoriatic arthritis. Sjogren's syndrome is autoimmune disorder, which attacks salivary glands and tear glands. Polymyalgia rheumatica, it causes muscle pain and stiffness. Juvenile idiopathic arthritis affects children, and soft tissue rheumatism, also very common condition, and it is called soft tissue rheumatism. Word rheumatism is used here also, and it's just fibromyalgia, it's muscle pain, which is very common, and it also has psychological component. This is very common condition, and treatment is antidepressants in many cases. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.